Dr. Baliga here. This podcast is a multiple choice question preparation for the boards from an outstanding chapter titled Perioperative Medicine in Baliga's textbook of internal medicine, available at mastermedfacts.com. The chapter is authored by Dr. Hugo Quinny Cheng, MD, who is professor of medicine at UCSF. He also completed his medical school and residency training there. He works as a hospitalist with a clinical focus on perioperative medicine. He also directs the Internal Medicine Board Certification and Recertification Review CME course for UCSF's Department of Medicine. A 50-year-old man with hypertension is scheduled to undergo posterior lumbar spinal fusion. Which of the following findings on his preoperative evaluation should prompt delay or cancellation of the planned surgery? A. Frequent premature atrial complexes on EKG. B. Myocardial infarction 1 year ago treated with thrombolysis. C. Atrial fibrillation with normal ventricular rate. D. New complaint of dyspnea and a finding of a third heart sound. And E. Baseline serum creatinine of 2.1 mg per deciliter. What are the keys to history and physical examination prior to surgery? The history should focus on identifying the presence of cardiovascular disease as described in the Revised Cardiac Risk Index. As you all can recall, the Revised Cardiac Risk Index is a widely adopted prediction tool which includes risk predictors: 1. Ischemic heart disease, 2. Congestive heart failure, 3. Cerebrovascular disease including stroke or TIA, 4. Chronic kidney disease, that's serum creatinine greater than 2 mg per deciliter, 5. Diabetes requiring use of insulin, and 6. Major intrathoracic, intraperitoneal or suprainguinal vascular surgery. The internist therefore should inquire about symptoms such as angina or dyspnea that may point to undiagnosed heart disease. The severity and stability of established heart disease should be assessed with particular attention to determining whether the patient has active heart disease that warrants delaying surgery. Finally, it's crucial to determine the patient's functional capacity. Physical examination can also help detect undiagnosed cardiac disease and assess the severity of known disease. For instance, a murmur suggesting severe aortic stenosis warrants further evaluation with echocardiography. The presence of a third heart sound, elevated neck veins, or peripheral edema can indicate volume overload from decompensated heart failure that requires treatment prior to surgery. In this 50-year-old patient, the answer to the question which of the following findings on its preoperative evaluation should prompt delay or cancellation of the planned surgery is D, that is, the new complaint of dyspnea and a finding of third heart sound. Patients should not undergo elective surgery if they have severe or decompensated cardiac disease that requires immediate evaluation and treatment regardless of the upcoming operation. The findings of dyspnea and a third heart sound suggest decompensated heart failure, which should be addressed prior to surgery. Atrial ectopy and EKG, remote myocardial infarction, rate-controlled atrial fibrillation, and stable chronic kidney disease do not require urgent management and are not contraindications to surgery. This short case scenario is from an outstanding chapter titled Perioperative Medicine in Baliga's textbook of internal medicine, available at mastermedfacts.com. The chapter is authored by Dr. Hugo Quinny Cheng, MD, who is professor of medicine at the University of California, San Francisco, where he also completed his medical school and residency training. He works as a hospitalist with a clinical focus on perioperative medicine. He directs the medical consultation service and co-management with neurosurgery service and regularly teaches about preoperative medical evaluation, perioperative medicine to residents and practicing physicians. He also directs the Internal Medicine Board Certification and Recertification Review CME course for UCSF's Department of Medicine.